Shalom Akulam. Good evening. We hope and trust that you all feel well, despite the news and the videos coming from Israel. Welcome to the Ethical and Halachic Challenges in Caring for Loving Ones with Dementia online panel, hosted by Emda and Zohar. My name is Boaz, and this event is a result of extensive and a productive partnership of these two organizations, which we cherish, and we hope this collaboration will grow, looking for many more occasions to do that. We will hear more about Emda later on. However, I'd like to share something short before we start and launch the conversation about Zohar's new the new English website, which we just in the last few days launched, and we're happy to share it with you. As you know, Zohar is active in keeping Israel Jewish together by accessing a more inclusive, moral, and friendly user Judaism. We do so by providing services and content for the Israel society for almost 3 decades. And a few years ago, we established the Zohar Ethical Center, aiming to advance ethical values and practices in the Jewish spirit, both on a national level and by individuals. And one of our major services we provide is the Zohar Ad 120 service, which this program is part of it. As you know, very often when our parents or beloved relatives reach towards the end of life, many questions rise, and we are here with an amazing service of combining a rabbi and a social worker to go through the process, to be able to ask the questions, to understand where we are at, what are our options. It's an amazing program, which I'm privileged to be part of the team who are doing that. And to support that, we've launched the online Zohar Ad 120 English website. Let me just share it with you. Which can I'll send it to you on the chat in a second. And hold on, something happened to my share, as always happens. So if you log on, if you log on the Zohar Ad 120, you all see what I'm doing. And you see the going to the English website, which now comes up. You'll be able to see, first of all, the contact info for the service which I've just mentioned. It's a service. Simply call us and we'll be there in less than 24 hours. We'll be able to assist you. Aside of that, in the website, you'll be able to find a lot of materials and content, like the special booklet and that we have produced of halachot treating a terminal 3 patient and a person living with dementia. A lot of chapters involved. You can see that. You can download it if you wish. You can send us questions, and we'll be able to answer them. And then hopefully, if they are relevant, we'll load them to the website. And many articles, position papers, a lot of materials. And I welcome you to use this website, which we have launched just recently. I'll send you the links both to the website and to our Facebook page, so you'll be able to follow us and be part of this initiative. So without further ado, I'd like to welcome our two speakers, Dr. Dana Pe'er, which will start, a gerontologist, an occupational therapist, and dementia specialist, along with Rabbi Yuval Sherlo, who's the director of our Zohar Center for Jewish Ethics, to lead this conversation on the ethical and halachic challenges in caring for loved ones with dementia. So, Dr. Pe'er, why won't you start? And we'll take it from there. Before we do that, just two comments, technical comments. We welcome your questions. Please use the chat to do that, and we'll address the questions along the conversation or towards its end. And one second and last comment, this panel is videoed into our YouTube channel, and you will all receive a link to watch it later on as following this conversation. So, Dr. Pe'er, the stage is yours. Thank you very much.
Good evening to all. I'm going to share my screen so that you can see it. All right. So, evening, everyone. I am not a social worker. I am an occupational therapist and a gerontologist. I've been working with people with dementia for over 20-something years. And I know that the first thing we need to do is lay the baseline for what is dementia. So very quickly, I'm just going to give you a few points to so we know we're all talking about the same thing. And I'm going to go very quickly, because we have a time limit, to principles of effective communication in dementia. And I will touch upon behavior problems, and we'll talk about that further on later. So what is dementia? First thing, and most important to know, that dementia is not a part of normal aging. We do not expect someone to have dementia or to be senile just because they reach a certain age. Dementia is actually a neurodegenerative disease, okay? It's not something that happens just because you've reached late life. It is actually defined as an acquired decline in memory and cognitive function. It has to cause functional disturbances. As long as the person has different cognitive abilities, but it does not disturb their daily function, it's not going to be dementia. And we're always going to compare it to their abilities beforehand, means how they were their whole life and how they are now. So if a person who had difficulty in finding places throughout their whole life, we're not going to be surprised and say, well, now they have dementia because they're having difficulty finding a certain place, okay? Think the shopping mall. Where am I going? I never know. So I don't have dementia. Sadly, dementia is chronic. It will always get worse. And as of now, it is incurable. We do not have any medications or treatments that will stop the dementia, that will reverse it, or actually cure it. That's the way it is right now. I know in the US, there are all kinds of initiatives and a lot of push to work on all kinds of therapies. But as of now, we're at the point where there is nothing that can cure it. And the final point I want to make is that Alzheimer's, which often gets confused with the word dementia, it's because Alzheimer's is the most common type of all the dementias. There are over 50 types of dementia, at least. I know about 20 by heart. They're really long names of areas of the brain, but Alzheimer's is the most common, and almost all of the research in the world is being done on Alzheimer's. About at least 60 to 70% of the dementia incidents are of the Alzheimer's type. So not everyone has Alzheimer's. Even if they have dementia, they could have another type. But having said this about Alzheimer's and dementia in general, I do have to say that when it doesn't really matter from my point of view, because I am not a doctor, I am not a researcher, I am not a scientist, I am not trying to find the cure. I am trying to make life better for the person with dementia and the people who are in the family who are caregiving. So in that respect, everything I will now suggest has to do with how can we make life better, quality of life better for you as a caregiver, and by proxy for the person with dementia. Because if I can make your life better and easier for you, you're going to be more relaxed and more able to get cooperation, and therefore they will also be more relaxed and more cooperative. So I'm going to give you a few principles of what you can do to be more effective in your communication. I will say, please do not get stressed out. These principles are actually kind of counterintuitive to what we usually do when we start taking care of a person with dementia. So the first thing that often we do is try to test their memory, right? Because we're trying to keep them from deteriorating. We want to keep them in the state where they are now. So we try to ask them all kinds of questions like we used to do when we had children, when we were trying to bring them up forward, to challenge them. Challenging a person with dementia does not work. This will not keep them better off. It will not stave off deterioration. It will not keep them more focused, okay? When you are testing a person with dementia, they know you are testing them. They know that you are trying to see, do you know the answer to this question? They do not like that. Just like I don't like that. I don't like tests if you didn't tell me we're going to have a test, right? I'm not going to cooperate. So what we do actually by doing this, which is a mistake, is we set them up for failure. We make them feel frustrated, not worthy, ashamed, maybe humiliated even, because they don't know. And what they do is maybe they lash out. Maybe they throw it back at us. And we're like, well, we're impressed because, they know how to throw it back at us, but they don't know and they feel bad. And feeling bad is not good. It's not good for them. It's not good for you. They're not going to cooperate. So we want to stop testing their memory. I am very, very pro reminiscence. Reminiscence is great. Please do reminiscence, but you don't do the reminiscence by asking them who's in the picture. If you're looking at a photo album, where was this taken? What time was this taken? What did you do after that? No, instead, when you are doing reminiscence, whether it's a photo album or something that you just remembered and you want to talk about, you offer the information, share what you know, and that will help them retrieve their memories. It will bring up the memories more spontaneously. They will engage better if you share your information, which is what we usually do when we're talking with other people, rather than trying to test them and challenge their memory. Another thing I want to offer to you is when we are trying to get cooperation. Generally speaking, when you ask a person with dementia, would you like to? The answer is going to be no. There's a reason for that. It's much easier to say no rather than to commit to something that I'm not really sure what you asked me to commit to. So they're going to say no. But I want them to do it, right? So instead of saying it in a different way, like a question, what do you want for breakfast? Which is an open-ended question. There are infinite possibilities for what I want for breakfast, and trying to retrieve them spontaneously from my memory is very difficult for a person with a memory problem. So I want to give them a choice, but I don't want to ask them, what do you want to ask? What do you want to eat? I also don't want to ask, do you want? Because the answer is going to be no. And then they're going to get up a half an hour later and go get something in the kitchen and make a mess, right? So we don't want that. What you do want to do is state the task. Breakfast, it's time for breakfast. And then give two options. Do you want eggs or toast? Because I want them to feel in control, that they have a choice, that it's a process in which they are also a part of, not just me bringing down things on their head and saying, this is the way it is, because they are not in the army and they don't think you are the commander in chief. So I want them to have the feeling of being engaged, but it's not going to be, what do you want or do you want? It's state the task, give the two options. Oftentimes, and I'm sure everyone who is taking care of a person with dementia has heard this, do not argue, just go with the flow, because you are never going to convince them. And this is true. Trying to get a person with dementia to accept my point of view, the way I see reality, is a complete waste of time. Totally. It's a waste of time. It's a waste of energy. You are never going to be able to convince them that they are wrong and you are right. And even if you do convince them today that indeed, you are right and they are wrong. And their mother passed away 20 years ago, and here's the picture with them standing by the grave. Don't do that. If you do that today, tomorrow morning, what's going to happen? Start over the whole thing, because they're not going to remember it over time. So generally, what we suggest doing is accept their reality. I'm going to say even embrace their reality. Okay, that's going to serve you so much better in taking care of them and of yourself. But I know what you're thinking. Everyone's like, well, he said that I took all his money, or he's blaming me for this, or he's blaming me for that, or things like that. So should I say, yeah, Dad, you're right, I took all your money? Of course not. You don't need to agree with what they say. Okay. You don't have to agree and say, yes, Dad, please don't do this. Do not say, yes, Dad, I took all your money. It's not going to work. What you need to do, or what I'm going to suggest that you should do, which will make it much easier for you, is first of all, repeat what they said. Okay. This is like, let's think of it as a tool. You can take this and put it in your toolbox. Repeat what they said. Your father says, you took all my money. I know you just went to the bank and you got it all out. You don't say, Dad, are you crazy? I wouldn't do that. Why would you even think that? No, you say, Dad, I hear you are concerned about what the money in the bank, because that's what he is. He's concerned. He's worried. He's not really sure who's taking care of the money, and maybe it's him, but he's not sure. So if he doesn't really know, there's only one possible explanation. Someone took his money, and hey, you happen to be here. It's probably you. So the first thing we do is to repeat what they said. And sometimes that will be enough, because what people with dementia, well, everybody, but especially people with dementia, really, really want, and really just they crave it, is for someone to listen to them, to hear them out, rather than immediately negating what they say, dismissing that the way they think. They want people to be on their side, to hear them out, to understand them. And when you repeat what they said, not saying, yeah, Dad, you're right, but saying, I hear that this is what is concerning you, that you are worried about this. You are letting them understand that you understand them. You're reflecting back to them what they said. You could only reflect something if you heard it. All right. And you're thinking touchy-feely. This is an expression I can only use in English. People in Hebrew does not work. But you want to think touchy-feely, which means we're talking about how they feel, not about the logic of course, I wouldn't take your money. Why would you blame me for this? I have enough money of my own, I hope. But you want to think about how they feel. He is feeling concerned. He's worried. He's anxious. He's not sure what's going on. So he's lashing out. And how can we address the way he feels rather than the logic? This will further the conversation, or will enable us to offer a solution much easier and much faster, rather than talking about it logically. Another thing regarding this is the facial expression, your tone of voice, everything that's nonverbal communication. And if you talk to a communication expert, they will usually tell you that like at least 90% of communication is nonverbal. And dementia, it's especially so. People will oftentimes address or pay attention more to how you say it rather than what you are saying. This is especially true as the dementia progresses, but how you look when you say it, and often you need to smile. You need to smile so much more. The tone of voice you're using, your body language, how you're standing next to them with your arms open or not, and we're all Jews and we speak a lot with our hands. This is good. Gesturing is very important. You need to gesture more. Can't believe I'm saying that, but yes, gesture more. Okay, so all these things will help us in giving them a sense that we are on their side. We understand them, rather than immediately dismissing what they are saying to us. All right, I did that. Okay, I'm going to end with one last thing. When we're talking about behavioral changes in dementia, there are many, many issues. There are so many different possibilities. And this is just like a list, and it's not a complete list of, let's say, the headlines or the titles I can give, but for each person, it will be different. And the number one thing that I want you to know about the behavior change that you will almost never hear about, which is most common, I'm willing to say that in Israel, it's like 99% of the people with dementia have this behavioral change. It's called anosognosia. They don't have it in Hebrew. I have to say it in English, even when I'm talking in Hebrew. So this is really good for me. What is anosognosia? It essentially means that it's a cognitive dysfunction, okay? Just like all the other cognitive changes, this is also a cognitive dysfunction. And what it means that the person with dementia is lacking insight. They do not understand that they have a problem. They are not able to look at themselves and their function and say, whoa, I am not doing what I'm supposed to be doing. I have not taken a shower in 3 days, or I'm not able to cook like I used to. All right. They are lack self-awareness. And there is no way that you are ever going to convince them that they are not as good as they used to be. Okay, and it is not denial. It's very important to understand. This is why they refuse help. This is why they refuse assistance. But it's not, it's not denial in itself. They're not saying like what, Freud taught us that there's denial, emotional denial, and all that. This is cognitive. Therefore, talking about it, explaining it is not going to work. Everything we do with dementia, person with dementia regarding coping with behavioral changes is usually going to be working around and not directly with the person. And I will talk about that further in my next session. And now I'm going to leave this presentation and pass it on to Rabbi Sherlock.
Shalom, good evening. First of all, I'll start with apologizing about my English. Usually when I lecture all over the world in conventions, I say that I speak the most common language in the world, and that is lousy English. But I'm used to have, Chinese professor here or someone from Japan, and his English is worse, so I feel better. But in this evening and with Dana, it's much more difficult, but I'll try to do my best. I want to emphasize two ethical points that are very important when we deal with dementia inside the family. The first one is the entire story or the entire family. We are used, definitely, or especially because of the 10 commitments, includes "Kabed et avicha v'et imecha," you must honor your parents, that we should dedicate all our efforts, all our properties, everything, and concentrate only of taking care to our parents that are getting older and dementia and whatever. Now, this is a good thing and a bad thing. From one hand, we always have to understand, and the halacha says that, and also the ethical approach is that when we talk and we speak about honoring our parents, it's not that kid that comes when he's 10 years old from school and brings a flower to his mother, or obeys when she gives orders, or whatever, cleans the house, whatever. When you read the details of the halacha, you see that the halacha is talking about the other side of life, the other side of the coin. That means that we should take care and we should honor and we should do everything the word everything, I'll fix it soon, but let's say now, allow everything that we can in order to that our parents, when they're getting older, and especially when there's dementia and they cannot take care of themselves, to do everything towards them. But we have to understand, and it's also halachically and ethically, that this is not the only commitment that we have. We have a husband and a wife, we have children, and we have also ourselves. It may be a surprise that the Mishnah says that if your father lost his wallet and you lost your wallet, avidatcha ve'avidat avicha, you are permitted, or maybe even you should look for your wallet before your father's one. And this is a surprise because we think that we should give up everything and do everything in order to honor and to help our parents. So therefore, the Gemara says, how come? And the Gemara says, Shilcha kodem v'shel kol adam. Your needs are before even everyone else, including your parents. Why? There are many reasons and many explanations. It's not that you should be egoistic, but the idea is that if you try to live life when you dedicate everything towards your parents and forget and ignore and abandon yourself, your family, your work, your everything, first of all, you'll collapse, but it will be also bad for them because you'll be full of anger, you'll be frustrated, you'll be very disappointed. So therefore, the first ethical in the idea is that there are many factors and many notions that we have to do during our lives. And we have to try to formulate a way where we do what we can do towards our parents, but not forget our other commitments, not forget ourselves, and not thinking that it's a kind of an egoistic approach. It's really the right thing from the ethically point of view and also from the halachic point of view. And this is something that is very, very important when a family starts all the process, all the the appearance of the dimension, and our parents are starting to decline, and separation between their body and their soul and whatever. This is something that is very, very important to understand, to look up on the wide range of the picture and not uh, forget everything else and do everything for our parents, even though it seems like this is the right thing to do. So I'll try to summarize the first point, the first ethically and halachic issue, Shelcha kodem l'shel kol adam. Your needs are before, not more important, not more holy, not, but you should take care of yourself and your family and your needs before you do everything else. And as I said, it's really a surprise because we are really used to think that someone has to give up everything of his own, and the ethically approach and the halachic one is different. The second point, and that we are in Zohar Ad 120, that we're being asked many times is uh, can what to do when we are speaking according to what we heard from Dr. Pe'er to our parents, but actually sometimes we are lying, sometimes we don't say the real truth, we are trying to escape from their criticism, we are, smashing them or whatever. And is it permitted according to the ethical approach and the halach approach to do that? And this is a very, very important point. From the when our parents or when the person with dementia is not able anymore to control and to understand the situation, and he is starting to live inside himself, the only thing that is important from now on is quality of life. Is quality of life. It, I'm not saying that it's better to lie to him because this is not the, this is not the truth. Many times it's to ask him questions, to respond, to be a mirror, to like we heard from Dr. Pierre, there are many kinds of responses. But we should understand that from now on, all the values that we were grown up, that he educated us, and we want to be towards the whole world, of dignity, of honesty, of saying the truth, of talking directly and not trying to do all kinds of tricks in order to escape from the real way, it doesn't mean from now on anything. The only thing that we have to ask ourselves is, am I saying something that will improve, that will help, that will that will promote, excuse me, his quality of life? And it's also the halacha approach. As you know, the halacha, from one hand, is it has a very extreme approach to saying the truth. And this is one of the pillars of the world. על שלושה דברים העולם עומד, על האמת, על הדין ועל השלom. This is a pillar, the truth. But from the other hand, we know that according to halacha, when there's a balance, there is a balance between truth and peace, truth and shalom, truth and to do good things to the person that we are talking to. From when truth and lie doesn't mean anything from now on, because as I said, and as we learned before, the person with dementia doesn't recognize anymore the differences, and they cannot distinguish between the variety of situations. This is the point that from now on, all our behavior should be only according to one value, and that is his quality of life, and are we doing good to him or not? Certainly, or it's very important that from our own perspective, we should be very strict of saying the truth from now on to other people in order not to lose the sensitivity and the importance of being honest, to be a pure person, and it's very important to educate ourselves. But we have to distinguish between two directions. For him, his quality of life, for us and for our family and for our kids, maybe we should be more extreme. It's more important to be very, very strict about saying the truth. And these two directions will create a character and a personality that behaves according to ethical values. So let me again say the two most important things about the situation of appearing of dementia in the family. One is to understand that it's very, very important to do everything that we can towards our parents or towards the person with dementia, but not to forget that we have other obligations and other commitments and other connections, and also ourselves, because it will be the wrong thing to abandon everything of this and to ignore our needs. It will not work also, but it's also the wrong thing to do. The second thing is, from now on, quality of life, this is the headline, this is the navigator, this is the direction. And from now on, the only principle that will work towards the person with dementia will be his quality of life. We should reconstruct our sensitivity towards truth and lie and all those values, and not to destroy ourselves. But him, the only thing is his quality of life.
Thank you very much, Yuval. Before we move to the second part of the discussion, I'd like you, Dr. Pe'er, to address two questions that were given to us in the chat. One is that Lisa is asking, is there a definite medical testing to diagnose dementia? And Sharon asked, if you see that what looks like a beginning of dementia and there are other health issues, what kind of doctor should be seen who can determine if there is a dementia starting? So I guess you're the person to address that. Thank you.
Okay, so these are really good questions. We'll mash them together and give a full answer. So if we have someone that we are concerned, and usually it's going to be an elder person, okay? Dementia is more common as we age. Number one risk factor for dementia of all kinds is chronological age. It's not how you feel, it's what's written in your identity card or your birth certificate. So if therefore, usually for a person who is above 65, I would recommend having a geriatrician see the person and address all the health issues. A geriatrician addresses all the health issues. They bring a very holistic view of health to the elderly. And for younger people under 65, if you think there is a cognitive decline, it would be a neurologist or a psychiatrist. Probably a psychiatrist. It's also a geriatric that has also geriatric training, but all three of them will be good. I always prefer the geriatrician because I think they started in the right way. They know best. And my experience with them is that they really do understand dementia more than other doctors. And regarding, is there definitive testing? The answer right now is no. The dementia diagnosis is basically reached based on a differential diagnosis, which means that they go through, well, it's not this and it's not that, and it's not this. Well, you probably got dementia. It's basically very clinical oriented. You come in and you tell the doctor. You have to come with the person with dementia because, like I said, oftentimes they are unaware. You tell the doctor the story, what happened, why you're there, all the symptoms that you've been seeing. The doctor will usually do blood tests and physical examination, send for some sort of imaging to rule out other things. And if there is a suspicion of Alzheimer's, they might send the person to do an LP, which will only confirm a diagnosis, but is not diagnostic in and of itself. So it's a holistic way of trying to figure out what it is. And even then, the answer is not always definitive. And there is no one test that you can do or any specific biomarker that we can find and that will point us in definitely the direction of diagnosis of a dementia. The Kupot Cholim do have geriatricians. It's probably going to take a few months to get to them because geriatrics is almost like psychiatry. It's really difficult to get an appointment. If it's something urgent, I would say go private if you can. That's what I think. All right, so should we continue? There's some questions for you if you want to add. You want to reply, or we'll continue on to the next point?
I think we'll continue and we'll go back to the questions later on. Thank you.
Okay, so I get to continue. Okay, so I'm just going to talk. This time, no screen to share, but what I want to talk about now is in the perspective and in the viewpoint of the halacha and the mitzvot, okay? And I'm going to suggest, like I said before, that the main goal of dementia and caregiving dementia is not to keep the person where they are and to stave off deterioration. Like I said, it's not going to happen. Let's be realistic. Instead, I want to offer you that the main goal is the emotional well-being of the person with dementia. That is the number one thing that we are concerned about. How do they feel? And everything that we do will be with this goal in mind, because keeping their emotional well-being positive will help us maintain positive relationships between them. And positive relationships with the person with dementia is the basis for caregiving in a way that will feel well, will feel right for us, and that we will get their cooperation. Because I, as a person, am usually, well, everybody, but let's take me for a person. We are very often motivated by how we feel, our emotions to the other person, okay? And if logic is out the door and it's not coming back, then how I feel about you is going to determine whether I'm going to do what you ask me to do. So the idea of thinking of their emotional well-being is what's going to get me more cooperation, to make them feel that I am on their side. We are in this together and we're going to be doing it together. Having this goal in mind, what we derive from this also relates to the mitzvot. A central practice of the emotional well-being of the person with dementia is reducing shoulds and needs. A lot less of he has to, she needs to, including regarding things of the halacha that they used to do in the past. So whether it's doing the mitzvah itself or whether it's the timing of when they do the mitzvah, okay? Because, well, especially for men, there are times of day when you have to do the mitzvah. You put on the tefillin in the morning. You don't do it after the sun sets. You pray shacharit at a certain hour, and after that, there's no longer praying shacharit. But what I want to suggest is that we need to relax our expectations, our dictation of when to do things, how to do things, and even whether they need to do them or not. Okay, because I think that the experience in the engagement with the mitzvah, with the halacha, is more important than, let's say, the quality of the doing. Okay. And if there's something that they don't want to do and they refuse to do it, then don't try to force them to do it or insist that they need to do it. I think God is more forgiving than that. But also, oftentimes, if they don't want to do it right now, okay, let's say that he usually puts a tefillin on right before breakfast and you want to eat breakfast and you say, well, put on the tefillin so we can eat breakfast. And he's like, no, I don't want to do it now. I'll do it later. And you're like, no, you have to do it now. So my suggestion would be relax, let it go. Oftentimes when we just say, okay, you can do this later, we put it aside. A few minutes later, we bring it up again and it's like, oh yeah, sure, no problem. Because the insistence of you have to do it now is our insistence. It's not their insistence. And I have to join their world, not expect them to join my world. So sometimes just taking a step back, whether it's like the tefillin, or even, you know what, even it's breakfast, or taking a shower, or going out, or whatever it is we think that they need to do, just letting go, putting it aside for a while, or saying, okay, you know what, maybe we'll do it again. We'll try it again later. It reduces the resistance and there's a higher chance of us being able to engage them in doing the mitzvah or whatever task it is that we're trying to get them to cooperate and do with us. Because the experience, if the experience is bad, they will remember the bad feelings. They will probably not remember what exactly transpired, whether you said this and they said that, and whether it worked out or not, but they will remember that, I don't like it. I'm not happy. I see you. I see this. I'm not happy about this. I don't want to do this. So the experience, the feelings, the emotions of the experience will last for a long time. And what we usually say in dementia is that people will not remember the what. They will remember how they felt and how they feel about you. So we're always going to think about how is their emotional well-being, because that's what's going to be the main motivator. It's no longer going to be explaining why you should do something. It's going to make you feel good, and then they will do it. Okay, so the experience of doing something is more important than the mitzvah itself. I'm suggesting humbly and engaging and keeping it over time, even if the execution of the mitzvah is not what it used to be. And usually if I have someone who used to pray the shacharit, and when they would take their time with it, and they would, I would say, even enjoy it, since they had more time after they retired. And now they're like doing it in 3 minutes and I'm done. And I'm like, but really, why would you can't be done. This is not a good response. And the heartache is my heartache. Hey, they feel that they're doing what they need to do and that's good enough for them. And arguing with them is not going to further our relationship. And it's not going to make them do it again or make them do it differently the next time. So I have to come to terms as a caregiver, and I know what I'm saying is really difficult to do. Do not think that I'm saying this lightly, but I want to suggest to you a different way of thinking and perceiving the needs and the shoulds and the have tos, and letting go of a lot of them. And I'm going to pass it on to Rabbi Sherlock.
Obviously, I'll speak from the halachic perspective. As all the rabbis are really dealing with the question, what category is the right category to deal with questions about mitzvot and things that you're permitted to do when we are talking about someone with dementia. The the first the first way to think about it is the din of shote, fool. And we have a lot of halacha that are considering and regarding shote, but he's not a shote. He's not a fool. Its dimension is completely different because we learned about even this evening what is the meaning of the cognition, of the feelings, of the. This is not the right thing and the right way to think about it. What we are claiming in Soha is something that, and we wrote about it in our book, and we wrote about it everywhere, is actually that the right way to think about it is from the opposite of a katan, of a child. The Gemara says that, I'll read it in Hebrew and you can read the translation in English. Katan hayodea lena'anea chayav belulav. If he's able to do that, so he must have a lulav. Lit'atef, he's obligated and committed to do tzitzit. Lishmor tefillin, and to wrap himself with the tefillin, so he's obligated to do that. So we can see that even the Gemara is talking, when we're talking about the child, that there is a connection with between the ability and the mitzvah, and the fact that you are committed to do that. Before you are able to do that, there's no commitment. When a child is able to be responsible on his behavior, then he must do that. So the same thing that is from the other side of life. And our claim, according to halacha, is that when a person cannot be responsible to his behavior from now on, he cannot be responsible of laying tefillin, of having lulav, and to be committed and to obey and to do everything that the halacha says he should do. From now on, he's patur. I mean, he's not committed anymore. Now, as we heard from Dr. Pe'er, it may be very good for him. He is committed to do that. Maybe the fact that it's part of his ritual of life, maybe the memories that are raising again because he's laying tefillin or uh, uh, lighting a Hanukkah candle, whatever. But these are not halacha principles. This is a treatment, and maybe it's very good for him. But when we are talking about commitments, from this point that he cannot be any more responsible to do things, from now on, he doesn't have to do them. And it's very important to understand them, not to, and Dr. Perez spoke from the perspective of his good life, uh, but I'm talking from the perspective of halacha. You are, and he is patur from now on, and from now we can think and we can ask ourselves if it's good for him. It maybe he wants to do that, but not to force him, and even less than that, not to push him to do that, because actually his emotional feelings can be very, very problematic. This is what we call, this is the approach towards mitzvot aseh. I mean, things that you have to do. Can I say that he can violate Shabbos? Let's say that he enjoys lighting the television and shutting it off, and lighting and shutting it off, and I play with the remote control or whatever. Should I stop him of doing that? Actually, it's very, very close to the same. I'm not gonna offer it, but if he wants to do that and he feels that this is the things that he wants to that makes him happy, we should not feel that we are responsible to stop him and not to do that from the same principles of halacha, because he is not the halacha is something that you have to do when you are able to do it and when you are able to control it, to be responsible on it. Once we are not there anymore, then the obligations are much less. The only thing that may be more problematic is kosher food. It's in Israel, it's not a real problem because in most of the institutes and all the places that if he's not living at home, so kosher food is not a real problem. And abroad, it is a problem. It's been asked. It was asked even 200 years ago. The Khatan Sofer was asked about it, and he said depends what are the circumstances. If it's a good care that he will get there, even if the food is not kosher, we should do everything that is good for him. If there is a way, and even if we must make efforts in order to do that, that he will not eat food that is not permitted, that is not kosher, that is treif, then we have to do everything that we can in order to supply it. But even as I said, if it's a very common question that we've been asked from abroad. Let's say that there are two institutes: a Jewish institute, a healthcare, a parent care, but it's very far. Nobody will visit him, and maybe it's a very low quality and low treatment that he gets there. And we have something very close to our house, but it's not Jewish. The food is not kosher, no Shabbos, but he will be taken care of much better. We will be able to visit him intensively and whatever. So there are many rabbis, and we support this idea that the right thing to do is to go to the institute that is very close to our house, and he will be taken care much better, even though the food is in Shabbos or whatever is very problematic there. But as I said before, he's not committed anymore. So if I'm trying to summarize, I'll say that actually dementia is the other side of the coin of childhood. And in the same way that we're thinking about childhood that is being escalating and more things he can do and he must do. So when we have dementia, we are going reverse. And as when we are declining and escalation, then our commitments are being lower and until we don't have any commitments anymore because we are not able to be responsible towards them. This is the halacha. And as we said, both of us said, not everything in this case is halacha. We have to also to ask ourselves if it's good for him, if good memories or something that can make him aware and awake and what. So these are important things. But halachically, don't force. Don't try to do things that uh, doesn't have any necessity to do them, and let the person with dementia have good life without those commitments and without trying to force them to make to keep the halacha, to observe the halacha as a technical thing, but without his cognition and without his emotional feelings. It doesn't have any value, and it doesn't have any necessity to do that.
Thank you very, very, very much. Really inspiring and knowledgeable. We'll try to do something very quickly though I cannot see how we still stick with the 9:30 limit that we have, so we may cross it. I say in advance. But we'll try to go question by question, one for you, Dr. Per, and another one for you, Rabbi Sherlo, and would allow you to address them. So Rachel is asking, can you give us some creative ways to include the loved one with dementia in smachot, e.g. bar mitzvah, weddings, prepare? What do you say?
Okay, oftentimes people with dementia really do have difficulty being in a large crowd of people with a lot of music and a lot going on. I always say I advocate for taking them and bringing them to the event itself, but you need to have a plan, an escape plan for them so that they can leave early if they want to, if they're feeling uncomfortable or inconvenient, or at least have a room where they can sit in quiet and away from everyone else and the commotion. And don't try to insist that they have to be here because everybody's here. We have to respect and understand that it's really difficult for them to be in this situation. It's overwhelming. It's really, really hard to process all of this. And insisting that they stay will only cause them suffering and us, because they will be engaging us in trying to keep them calm. So try to understand, we want to, but we have to understand where they are and do what we can to enable them to participate as much as they can.
Thank you. Here's a question for you, Rabbi Sherlo. Is the Tzor Ad 122 support relevant when the parent with dementia is outside of Israel? Please unmute yourself.
Excuse me. We're trying to do everything that we can everywhere in the world. We have some connections, especially to the United States and UK, where we're being asked all kind of questions and are supporting and giving advice. And even once we had a kind of a webinar, this kind of webinar with institutes all over the world. At Zohar Ma'av through the website, we'll do everything that we can do in order to help people also outside of Israel. It's much more difficult to do that because one, we don't know all the circumstances and the situation and the law all over the world, and B, as I said before, especially in Israel, it's much easier because actually even the state institutes are Jewish, are according to, you can feel they're very convenient. And abroad is much more difficult. But Zohar Me'av support everywhere. More than that, we are even willing to come to lecture and to events all over the world in order to promote the right approach and the right sensitive uh, behavior towards our old people that are having this disease.
Thank you. And here's another question for you. Are there any halachic obligations for the spouse of the person with dementia?
I didn't understand the question.
Ben azug, bat azug, of a person.
Sure. The halacha of him is that actually he's taking care of uh, uh, of someone that we consider it as a chole sheyesh bo sakana. That means it's not only inconvenient. Actually, the person with dementia is in danger because if you don't keep him, if you don't follow him, if you don't see what he's doing, depends. Everyone is different, but it's really a danger. So therefore, first of all, it's a commitment, it's an obligation of the wife or the husband to take care of him, but it's also things that he is permitted to do. Let's say on Shabbos, when you have to do something that will take care according to what their needs to a person with dementia. So in many cases, you are permitted to do it by yourself, even though you're not the sick person, but you are taking care of someone else. But these are questions that you have to ask rabbis. As I said, we are offering our answers, excuse me, because every situation is completely different. Not everything is permitted. But once the person with dementia is being considered as a חולה שיש בו סכנה, someone that is sick, that there is danger in leaving him alone, it actually says that there are things that you are permitted to do on your Shabbos in order to take care in the best way of him.
Thank you. Dr. Pear, can you help Sarah with the question of what do you suggest for helping with shower refusal?
I could, but it will take me about an hour. So I think we don't have that much time. I do want to say it's an issue, okay? It's a common issue. It's like one of the most common issues. It's not just you. The number one suggestion I would have was the person does not need to shower every day, okay? Just lower your expectations. Once a week, twice a week is like really, really good. Use the for Shabbat to as an incentive to take the shower. And if they only do it for Shabbat, you've already done a really great job. Other than that, it's a lot to talk about. So I'm sorry, I cannot just like off the top of my head answer this question better than that.
Thank you, Rabbi Sherlock. I have similar question, but not about showering. What about breaking Shabbat? What do you suggest? Deborah is asking, what do you suggest with a person that breaks Shabbat?
We heard it before, not to argue, not to try to force things, not to try to, first of all, as we learned in the first session from Dr. Peer, to first of all evaluate even his feelings, his wishes, his whatever, and talk with him and whatever, not to try to convince, not to try to do anything of this kind. He is, and if he insists that he wants to do here and that, so actually he could, because as I said before, we can't. We don't he's not obligated anymore to do things, and more than that, it's kind of abuse. I mean, honest, you can't convince him, you cannot change his opinion. It's not that situation that words will do that. So what can you do? It's he's doing what he does, and we as far as much as we can, are not part of it. I mean, it's his. I don't want to use the term decision. It's not a decision, but it's his behavior, and we should do whatever we can in order to do, to be with him, not more than that.
What you just described, Rabbi Sherlock, is true for like individual, I don't know, practices and behaviors. What about Ron and Linda Alchul ask? What about when the bracha or etc. affects other people, like kiddush or havdalah?
Okay, yeah, okay, that's a very common question. Can he say kiddush and that is has any meaning, and can he be, motzi yedei chova? Our opinion, according to many rabbis, is as long as he can say the words correctly, he can be even motzi yedei chova. Once he cannot do it anymore and he needs all kinds of help and assistance or whatever, we can let him do that in order to honor him and in order that he'll have good feelings. But we should make, for instance, kiddush by ourselves when he says that we should do it quietly, not to insult him, not to have any tension. But this is the line. As long as he can take responsibility, I'm not talking about understanding everything and being part of it, but doing it technically by himself, then he can be motzi yedei chova. But from then he cannot be. As I said, we can let him do that, or even have the expression that he is the head of the family and is still making kiddush, but we'll have to do it also by ourselves.
Thank you. And these for you, Dr. Pear, two timing questions, both by Joel and Doreen. What do you do when they have to go to an appointment if they don't want to go in time, or let's say they are getting stuck in repetitive activity that's making them late for, let's say, planned event, trip, stuff like that. They don't want to leave to the airport. What will be your advice for that?
Well, I'm very impressed someone is taking them to the airport. Kudos.
Yeah.
Let's start with that. But generally speaking, I do not think that we should give the person with dementia advance warning of a week or 2 weeks, unless you're interested in suffering. If you want to suffer, I'm all for it. I wouldn't do it. Meaning, I think we should give them notice close to the event. And you know how long, generally, it will take them to get organized. So if we have something in the afternoon, I'm going to tell them in the morning, oh, and this afternoon, we're going to this and this place. And then they'll say, well, why didn't you tell me? I should have been known about this. And I'm going to say, well, I'm sorry. I must have slipped my mind. I forgot about it. You know, I'm sorry. Forgive me, but we've already made the commitment. We have to go. Okay. And if it's a place that they don't want to go, you have to sugarcoat it. And let's say it's a doctor's appointment, which is often people don't want to go to the doctor. I totally get that. So you don't have to say we're going to the doctor's appointment. You say we're going out, we're going to be doing errands. Among them is the doctor. And you always have to plan to have something after the doctor, which is fun and something that they enjoy doing. So you always know that after the doctor, you're going to go and get ice cream, or you're going to go to that park, or go visit the grandchildren or whatnot. And you have to have this plan. And you do not ask the person with dementia, do you want to go? You say, well, now we did this, now we're doing this, and now we're going to do that. And the last plan will always be something fun, something that they enjoy. So, and if they're doing something, well, if they're planning, you're going on a trip from an airport, they should not be doing the packing. The packing should have been done earlier, and you should have been a part of that, because letting them pack will get a lot of interesting clothes to where you're going, not necessarily the ones that are going to work for you. But I would say, instead of trying to get them to stop, we're going to join what they're doing, and try to stop it there, which means I will say, okay, I'm going to help you pack. And this is all the suitcase we have. There's no more room. We're all ready to go. Let's go. And try to add something outside the door that's already distracting them.
Okay, thank you very much. Someone here in the name STC, which I don't know, I cannot interpret, asks about what if someone resumes to go to geriatrician or doctor to investigate one set of dementia. How to convince them?
Don't convince them. They don't need to know where they're going. Why would you tell them? Don't tell them. Take them to the doctor. Like I said, they don't need to know. And when you're already on your way, say, oh, I remembered we have to go to this place. They called and I promised I would go. I'm so sorry. But we can't not go. It's not something you do. And then you go. But you have something fun after that. Or if you're bringing the doctor to the house, you don't tell them beforehand. When he knocks on the door, you're like, oh my God, I totally forgot. But he's already there. People will be cooperative, nice to staff, to healthcare staff, to doctors, if they don't get time to prepare, to be against it beforehand. So don't give them the time to prepare for it. Okay, we think that it's going to work. It's not going to work.
Thank you very much, Michelle. What if the person, asks Michelle, loves to cook, but mix up meat and dairy?
Wait, sorry. I'm going to answer before Rav Shelo, please forgive me.
Yeah,
I'm going to say, first of all, you have to set up the physical environment in a way that separates milk and dairy. Why would there be milk and dairy? Is it meat and dairy together? You have them different places. Okay, they might get the dishes mixed up. But if you have specific dishes, which like you had this set and these pots for the dairy and then these for the meat, and then you knew that all the time, but they don't remember that anymore, paint them with blue or red spray paint, which makes it very clear what's for dairy and what's for meat, right? They give them the visual cues and separate where the meat and the dairy sets are where they're kept, and use the physical environment to direct the behavior so that they can continue cooking. And also you want to be there when they're cooking, okay? And but don't have, so you don't have to interfere and tell them what to do, but we can keep them engaged in what they enjoy doing and that they find meaningful. Sorry for busting in.
No, it's a very good answer, and you don't. I completely agree.
Okay, thank you. Dr. Parrott, Tamar is asking, how does one deal with delusions, especially when agreeing with them can have a dangerous result?
Number one, medication. Go for it. You have to have medications. No, seriously. Delusions and hallucinations and agitation require medications. Don't think twice. It's not just you, not for you, it's for them. They're suffering. Having delusions and hallucinations and being agitated is not fun. They are suffering as well. So you want to give them the medication. Other than that, we have to think about how we're also going to be talking about how they feel and try to distract them away from it. Okay. If they want to go usually people want to go home. It's not that they want to go to their house. They're just feeling insecure where they are. And we're going to try and think, how can we talk about their house, nostalgia, reminiscence, and what can we do to make them feel more secure in the place where they are now? And it's going to be different for each and every person.
Thank you. Tamar keeps asking, without brought us into people, that someone has dementia, how to deal with the delusional, where is it? Where'd it go?
People know.
Things they say to people.
Well,
saying,
everybody
saying
knows.
they
I'm
were
sorry.
in a
I'm
pigua, or
sorry,
saying they were.
but everybody already knows your parent has dementia. And if you think otherwise, you're kind of deluding yourself.
Okay.
I'm sorry.
That's right. That's right. I think that it's very important to understand that someone has to be shamed and thinks that he's responsible. And when he behaved in a bad way because he did bad things from his decisions, then you should be shamed. Once it's a situation. No one did anything wrong. No one did anything bad. But he's sick. I mean, he has this awful quality of life and dimension, whatever. So instead of hiding it, and instead of trying to cover it, the best way, and also from the ethical point of view, is say the truth. My father is not well, and please don't get insult from what he's saying, or don't take it too seriously. And uh, it's not something that it's his fault. So therefore, it's not really something that he should be ashamed of.
But here's the downside for this approach. Leah Klein is asking, so what do you do to deal with your dementia parents who enjoys being with their friends and they recognize she's getting worse, but they become a bit reluctant to get together? You were open, you didn't hide anything, and now it comes back to you. That's something that she enjoys doing. And now people are reluctant from doing that.
They're going to be reluctant whether you tell them or not. I'm sorry, this is the kind of thing that you find out who your real friends are and the real nature of people. Some people will have more chesed and be more rachamim, and they will be more there for the person with dementia despite the challenges it presents. And other people will, recede into the background and leave. And there's really nothing you can do about that with all the heartache and the heartbreak. People know they're going to do what they're going to do, whether you tell them or not.
Okay,
absolutely.
We'll take two last questions, okay? And then we'll end with that. We welcome you all. Please send us questions. There are different ways. We'll send everybody the ways how to do that. But the two last questions, one has to do, it actually came from two directions, about when they scream and their character is, they're in a bad mood. The mood changes frequently, and what to do with that.
I think that oftentimes the mood changes have to do with me telling them what they need to do Okay, people with dementia are not aggressive in and of dementia itself, usually. 99% of the aggression that we hear of, whether it's verbal aggression or physical aggression, is actually a response to something that happened, that the caregiver did, or that they did not understand what they were requested to do. We can avoid and prevent most of the aggression that we hear of if we attune our caregiving to the person with dementia. And like I said, do not demand that they have to take their medicine right now. Nothing will happen if they take their medicine 15 minutes from now.
And Beth asks, what if the person refuses to take any medication?
Well, like I said with the showers, I have a lot of ideas, but it's going to take me a long time.
Okay, with your permission, thank you. I would like to thank both of you, Shelo and Dr. Pear, for the amazing, amazing session. Very enriching. I'm dealing with questions like that, and I was very enriched with this session. And with your permission, I will only take one question to answer myself. And I mean, the question is, what time this session is over? And I'll say now. So have a good night, everybody. We'll send you all the link, and hope to see you in our next session. Night.
Thank you.
Thank you very
Thank
much.
you for the opportunity to practice my English. Wow, it was great.
Thank you very much.
Thank you for suffering my English.
Thank you.
Bye-bye.
Okay. Good night.